Welcome to Chapter 7, the Integumentary System. CPT is copyrighted by the American Medical Association. CPT is a registered trademark of the American Medical Association. In this chapter, you will understand the key components of the skin, hair, nails, and the breast. You will define key terms. You will understand the most common pathologies that affect the skin, hair, nails, and breast. You will understand procedures and surgeries as they relate to the skin, hair, nails, and breast. You will recognize common eponyms and acronyms for this section. You will identify when other sections of CPT or ICD-10-CM should be accessed, and you will know when HCPCS Level 2 codes and modifiers are appropriate. The integumentary system is the largest organ system and includes the skin, hair, and nails. Also included in the integumentary system of CPT codes are the procedures performed on the breast. The anatomy of the skin. On page 75 in your CPT code book, you can find a diagram of the layers of skin. It is important for you to understand that there are two layers of skin. The epidermis, which is the top layer, that is made up of 4 to 5 layers, and its main function is protection. Why 4 to 5 layers? Well, the soles of your feet and the palms of your hands will have 5 layers. All other parts of the body will have 4. It is important for you to know the names of those 4 to 5 layers. Those can be found in your textbook on page 37. The epidermis is comprised of the stratum corneum, which is also called the horny layer, the outermost layer. The stratum lucidum is going to be the clear layer on the palms of your hands and on the soles of your feet. The stratum granulosum is the granular layer of cells. It contains 2 types of granules: keratothylene granules and lamellated granules. Next is the stratum spinosum. These are composed of prickle cells that are interwoven for protection. The final layer of the epidermis is the stratum basale, also known as the stratum germinatum, which is the deepest of the 5 layers and made up of basal cells. The second ultimate layer of the skin is the dermis. The dermis is located deeper, just under the epidermis. It has 2 strata. The stratum papillar, which is the thin superficial layer interlocked with the epidermis. Then you have the stratum reticular, the thick layer of dense, irregular connective tissue. Underneath the 2 layers of the dermis, you then have the hypodermis, which is going to be the subcutaneous tissue, which is comprised of the connective tissue and fat tissue, which is known as adipose. You will also find sebaceous glands, sweat glands, hair shafts, and blood vessels running throughout the layers of the skin and the hypodermis. Underneath the dermis, you are also going to find the fascia, Fascia. There are 3 parts to the fascia. The fascia, you will have superficial fascia, which is kind of interwoven with the layers of the skin and the subcutaneous tissue. Then you have the deep fascia, deep as in meaning muscle and bone, so that's going to be around the muscles and the bones. And then we have visceral fascia, which is going to be close to the viscera, the organs of the body. The ICD-10-CM codes that are important to recognize for the integumentary system come from Chapter 2 of the ICD-10-CM code book, and those are the neoplasms. Chapter 12 is for the diseases of the skin and subcutaneous tissue, and Chapter 19, which are for injury, poisoning, and certain other consequences of external causes. Additional codes may be used for disorders of the breast, which are often found in ICD-10-CM Chapter 14, Diseases of the Genitourinary System. This table here is an excerpt from your neoplasm table from your ICD-10-CM codebook. And if you notice, there are several columns. The first column states malignant primary. That is where the cancer would have began. Malignant secondary, the second column, that is where the cancer would have moved to, metastasized to, grew to, extended to, or METS, M-E-T-S. CA in site 2 is the third column. CA in site 2, that means the cancer is within the tissue. It is encapsulated. It is not likely to leave that encapsulation. The fourth column is benign. This means the cancer, the growth is benign. It is not likely to grow, move, or go elsewhere. The fifth column is uncertain behavior. This means the physician in the record has stated, the cancer is uncertain. I do not know if it is malignant, if it is CA in site 2. I do not know if it's benign. And then the final column is unspecified behavior. Unspecified means, let's be real, the physician, the practitioner was lazy. They did not tell us if it is malignant, if it's cancer in site 2 or benign. Now, we need to be aware that some cancer terms, whether the physician says they are malignant or in site 2 or benign, we have to know those cancer terms if that term means benign or malignant. And that is where our index to our ICD-10-CM book comes in very handy. You can look up the word melanoma, which is a common skin cancer. And in the index, it will tell you if what you need is not here, you need to go to the neoplasm table, and it will give you guidance, and it will say, look under neoplasm table, malignant, or it will say look under the benign column. So if they give you a cancer term, such as adenocarcinoma or melanoma, the index, you have to start there first because it will give you guidance. If what you need is not there in the index, then it will guide you to the neoplasm table and it will tell you what column you need to use to pick your code. Now, you have to understand, if you hear any of those words that I mentioned earlier, it grew, it extended, it moved, it metastasized. Those are key words to tell you that we're talking about a secondary malignant cancer. When we look something up in the index, such as adenocarcinoma, and adenocarcinoma tells us to go to the neoplasm table, the word adenocarcinoma is replaced, or if we're talking about another cancer term, that cancer term is replaced by the word neoplasm. Once we are to the neoplasm table, we then need to come to the organ or body structure or skin, and then we find that part. So, for example, if we're talking about cancer of the ear, we're talking about the skin. So we would come to the word skin on the neoplasm table. Then we would need to look under ear to see, well, did they say it was BCC, which is basal cell carcinoma, or did they say it was SCC, which is squamous cell carcinoma? So we just need to be very careful. If we're talking about the skin, we need to look up the word skin. But if we were talking about adenocarcinoma of the prostate, we would come to the index first, look up the word adenocarcinoma. If prostate is not listed under there, then it will give us guidance and it will say, refer to the neoplasm table. When you come to the neoplasm table, you then go to the term prostate. Then you will need to pick, is it primary, is it secondary, is it in situ, benign, uncertain, or unspecified. And that's how you would utilize the neoplasm table. If you feel that you need more practice with the neoplasm table, please send me a message and I'll be glad to send you some extra practice problems utilizing the neoplasm table. ICD-10 Chapter 12, Diseases of the Skin and Subcutaneous Tissue. So in this chapter you will find skin infections, bacterial or fungal. You will find inflammatory conditions of the skin, and you'll find other disorders of the skin, such as corns, calluses, keloid scars, or keratosis. You might find dermatitis under inflammatory, erythema under inflammatory, rosacea, psoriasis. All of those would be found under inflammatory conditions. On this slide, you have some bacterial and fungal infections of the skin and subcutaneous tissue. Bacterial, you have carbuncles and furuncles, and basically those are boils. So if you think of car is bigger than an animal's fur, right? So car is bigger, so that's a cluster of boils, whereas furuncles, those are individual boils. Carbuncles and furuncles, those are typically caused by staph infections. Although they can be found all over the body, they are typically found on the neck. There are codes to identify whether the abscess is a cutaneous abscess, furuncle, or carbuncle, and to identify the site, meaning where at on the body. Cellulitis and lymphangitis are bacterial as well. Cellulitis is a bacterial infection in the deeper subcutaneous layer of the skin. Category L03 in the ICD-10 book. We know a category is 3 digits, so the category here is L03. That is for cellulitis and acute lymphangitis. Common fungal skin infections include athlete's foot, jock itch, ringworm, and yeast infections. Jumping back over to bacterial for a moment, impetigo would be reported with ICD-10 CM code category L01, and that is typically caused by bacteria entering the skin through cuts or insect bites. Inflammatory conditions of the skin include dermatitis, erythema, rosacea, and psoriasis. There are many causes and many manifestations, and we know that a manifestation, a disease, will manifest into another disease or problem. Dermatitis is an inflammation of the skin, derm meaning skin, itis meaning inflammation. There are different types of dermatitis, such as seborrheic, atopic, and contact dermatitis. Seborrheic dermatitis is found on the scalp, appearing as dandruff in adults. Atopic dermatitis is also referred to as eczema. Contact dermatitis is inflammation caused by an external irritant, such as laundry detergent. Psoriasis appears as patches of red skin covered in silvery scales. It is often very itchy and can be painful. Psoriasis is coded based on the type of psoriasis, and it is found in the ICD-10 code book under the category L40. Erythemia is redness of the skin due to capillary dilation. There are multiple types of erythemia. Rosacea is one of the most well-known erythemias. Rosacea typically occurs in adults, appearing as red pustules on the face. Additional types of erythemia include erythemia multiforme and erythemia nodosum. ICD-10 code selection is based on the type of erythemia. When erythemia multiforme is coded, code the associated manifestation, an additional adverse effect code if drug-induced, and an additional code from L49 to identify the percent of skin exfoliation. Other disorders of the skin includes corns, calluses, keloid scars, keratosis, diseases of the hair, such as alopecia, diseases of the sweat glands, such as hidradenitis, and diseases of the sebaceous glands, such as acne and skin ulcers. Pressure ulcers, decubitus ulcers, bed sores, all the same thing. An ulcer is a lesion on the skin caused by superficial loss of tissue. In ICD-10-CM, skin ulcers are selected based on the type. Is it a diabetic? Is it amoebic? And then you need the site. So where at on the body? On the buttocks. And if a pressure ulcer, we need to know the stage. A pressure ulcer is also known as a bed sore or decubitus ulcer and occurs when there is loss of tissue due to pressure on the skin. They are commonly located over bony prominences, such as the hip. When a pressure ulcer code is used from category L89, the codes identify both the site and the stage of the ulcer. There are 4 stages of pressure ulcers. Stage 1 is persistent focal erythemia. Stage 2 is partial thickness skin loss involving the epidermis, dermis, or both. Stage 3 is full thickness skin loss extending through the subcutaneous tissue. Stage 4 is necrosis of soft tissue extending to the muscle and bone. If you notice, stage 2 is going to involve the one or both layers of the skin. If the ulcer goes through the subcutaneous tissue, which is the hypodermis, then that's a stage 3. If it is necrotic and it reaches the muscle and bone, then that would be stage 4. ICD-10-CM Chapter 19, Injury, Poisoning, and Certain Other Consequences of External Causes, contains codes for superficial injuries such as abrasions, blisters, and contusions, and open wounds. Open wounds, examples would be laceration, bite, puncture, and these are organized by location on the body. Superficial injuries occur to the outer layers of the skin. This includes abrasions, friction burns, blisters, insect bites, and splinters. Contusions are bruises or hematomas. Superficial injuries and hematomas are not coded when they are part of a more serious injury to the same site. Open wounds include lacerations, puncture wounds, and open bites. Code selection is based on the type of superficial injury or open wound and the location. Most categories in ICD-10-CM injury and poisoning have a 7th character requirement for each applicable code. In most cases, there are 3 main 7th character values with the exception of fractures. In this section, A is initial encounter, D is subsequent encounter, and S is for sequela. To assign a code for laceration of the leg, documentation must provide enough information for proper 7th character selection. Burns and corrosions of the skin are assigned based on whether the injury is a burn or a corrosion. A burn is a thermal burn that comes from a heat source. except sunburns, such as a fire or hot appliance. Corrosion is a burn due to chemicals. Current burns and corrosions will be coded with the category T20 to T25. These are classified by location, depth, extent, and by agent, which would be the X code. Location, codes in the burn section are categorized according to the location of the burn. According to the ICD-10-CM guidelines, a separate code is reported for each burn site. The depth of the burn, there are 3 degrees of burns: first degree, second degree, and third degree. When there are multiple degrees of burns in the same location, the same 3-character category, code the highest degree burn for that location. When coding multiple degrees of burns in different locations, sequence the code for the burn of the highest degree first. TBSA, which is total body surface area. The total body surface area affected by the burn. According to the guidelines, a code from category T31 should be used to record burn mortality, such as in burn units, or when there is a mention of a third-degree burn involving 20% or more of the body's surface area. The guideline that this goes along with from the ICD-10-CM codebook is guideline IC 19D6. The rule of nines assists you in coding the total body surface area of burns. In this illustration, you can see how the body is broken down. External cause codes report how the burn occurred and where, such as while cooking in the kitchen. First-degree burns are superficial burns through only the epidermis. The area of the burn is usually red, very painful, and blanches to touch. The skin appears intact and no blistering occurs. In general, the skin involved in a first-degree burn does not lose its ability to function. A sunburn is the best example of a first-degree burn. However, it is not classified in ICD-10-CM with the rest of the burns. First-degree burns typically do not require medical treatment. Second-degree burns often are referred to as a partial thickness burn involving the epidermis and the dermis. These burns usually blister immediately and fill with a fluid. The blisters can be superficial or involve deep dermal damage. They are red, extremely painful, and the areas around the blisters will blanch to touch. The nerve endings are exposed in this level of burn, making them the most painful burns. Second-degree burns are usually caused by flames, chemicals, or hot liquids. Third-degree burns are full-thickness burns that involve the epidermis, dermis, and varying levels of the subcutaneous and underlying structures. Third-degree burns are commonly caused by electricity, chemicals, and fire. They require immediate medical attention. Disorders of the breast. There is only a small selection of categories of breast disorders in the ICD-10-CM codebook. Benign mammary dysplasias, N60 category. Inflammatory disorders of the breast, category N61. Hypertrophy of breast, category N62. Unspecified lump in breast, category N63. And other disorders of the breast, N64. And deformity and disproportion of reconstructed breasts fall in the category of N65. Dysplasia is abnormal tissue. The most common mammary dysplasia is fibrocystic disease or mammary cyst. Fibrocystic changes in breast are common and are often a diagnosis associated with an E&M code or breast exam. Category N64, other disorders of breast, is where you will find common signs and symptoms of the breast, such as pain in the breast. N64.4 mastodynia, and nipple discharge, N64.52. Also in this section is the code for galactocele, N64.89. A galactocele is a milk-fed cyst and is often cured by aspirating. The final category in this section is deformity and disproportion of reconstructed breast. These codes are often used when a correction to a breast is required after reconstructive surgery. Okay, moving on to the CPT section for integumentary. We begin with the subheading skin, subcutaneous, and accessory structures. The first category that we will discuss in this presentation is incision and drainage, followed by debridement, paring or cutting, biopsy, removal of skin tags, shaving of epidermal or dermal lesions, and excision of lesions, benign and malignant. Looking at the codes for incision and drainage, the first code is 10040 and describes acne surgery. The skin over the lesion is removed, the lesion is opened, and the fluid is drained. Codes 10060 and 10061 are for reporting the incision and drainage of an abscess, simple or complicated. When you're coding from this group of codes, it's important to distinguish between simple procedures and a complicated procedure. If the documentation does not specify simple or complicated, there are factors that determine what is considered complicated. You might want to write these in your CPT codebook margins near those codes. The mention of a placement of a drain, the use of gauze strip packing, the presence of infection, hemorrhaging that requires ligation to stop the bleeding, or extensive time involved in treating the lesion would all be considered complicated. The debridement codes are 11000 to 11047. Debridement is the method for removing dead tissue, dirt, foreign material, or debris from infected skin, a burn, or a wound. Code 11000 is for the debridement of extensive infected skin, up to 10% of the total body surface area. 11001 is an add-on code for each additional 10% of the body surface area. Because that code is an add-on code, we should know that we cannot bill that code by itself, so it would never be listed first. We also know that with add-on codes, we are not permitted to put a modifier 50, which is bilateral, or 51, which is multiple procedures, on add-on codes. Code 11004 to 11006 describe the debridement of necrotizing soft tissue infection. Your code selection is based on the area of the body being debrided. Note that code 11004 contains the common portion and is carried over to be part of the description of codes 11005 and 11006. There are also codes in the medicine section of the CPT codebook that describes active wound care management services. These should not be overlooked when coding for debridements. There are 3 codes in the paring and cutting category to report the paring or cutting of hyperkeratotic lesions. Hyperkeratotic is the medical term meaning a corn or a callus. Codes here are selected based on the number of lesions removed. If there were 3 corns removed, you would use code 11056. If 8 corns were removed, you would use code 11057. Biopsy of the skin is broken out into 3 different types of biopsies. If you did a punch biopsy on 3 lesions, you would code 11104 and 11105 times 2. What's significant to remember about these codes is that they are used to report a biopsy to obtain tissue for pathologic examination and is unrelated or distinct from other procedures reported at the same time. The guidelines in this category say that during certain surgical procedures, tissue is removed and submitted for pathological exam. The obtaining of the tissue during another procedure is not considered a separate biopsy and isn't separately reportable. You might see reference in the medical documentation to a shave biopsy. A shave biopsy occurs when the provider uses a sharp instrument, such as a scalpel, and slices the suspicious lesion as close to the base of the lesion as possible. When the provider chooses to do a shave biopsy, the wound often is covered by a bandage and does not require suturing. Removal of skin tags has 2 codes. Code 11200 is for the removal of skin tags up to and including 15 lesions. The add-on code 11201 is for each additional 10 lesions or part thereof. So what does that mean? So if we have 16 lesions, how would we code that? Well, we would code 11200 for the first 15 and 11201 for the additional lesion. If we had 35 lesions, how would we code that? We would code 11200 for the first 15, 11201 for the next 10, which makes 25, and then we would code 11201 again for the other 10 lesions. So we would end up with 11200, 11201, 11201. Or you could write that as 11200, 11201 times 2. The shaving of epidermal or dermal lesions is a removal of a single lesion by transverse incision or horizontal slicing without full thickness dermal incision. These procedures include local anesthesia and chemical or electrocauterization of the wound. The codes are selected based on the size of the lesion and where on the body it is located. These types of lesion removals do not require suture closure. As we move on to excision of lesions, you'll see there's an illustration in your CPT code book showing the method for measuring lesions. The measurement is critical for correct code selection. The lesion diameter plus the narrowest margins required equals the excised diameter. An excision is defined as a full thickness removal of a lesion, including margins, and include simple non-layered closure when performed. Code selection is based on whether this lesion is benign or malignant. Code is also selected based on the size of the lesion in centimeters and where on the body it is located. Report each benign or malignant lesion excised separately. There are words or phrases in the guidelines you may want to highlight, such as report each lesion separately and the different anatomical locations. Code 11400 is excision of a benign lesion, including margins, trunk, arms, or legs, 0.5 centimeters or less. Codes 11401 to 11406 are of the same anatomical location, but larger in size. If the closure of the defect created by the excision requires immediate or complex closure, it may be reported separately. You will want to read these guidelines carefully before coding from these categories. The Nails subheading represents procedure codes for the fingernails and/or toenails. There are 2 illustrations of the lateral and dorsal views of the nail anatomy in your CPT book, and these may help you in coding these procedures. Podiatrists use these codes extensively. Code 11719 is the trimming of nails that are not defective. This code is used whether 1 or more nails are trimmed. Debridement of nails is a more extensive service using various tools and files. Code 11720 is 1 to 5 nails, and 11721 is 6 or more. You might be wondering why someone would go to the physician to get his or her toenails trimmed. An example would be of a person who is diabetic with peripheral neuropathy and has a loss of sensation in the feet. There's the danger of cutting the skin and not knowing it. The chance of infection with subsequent complications is significant. In many instances, a third-party payer will pay for debridement of nails when the presence of an underlying condition is documented. Routine foot care in the absence of a chronic disease is generally not reimbursed. A pilonidal cyst is a sac under the skin at the base of the spine that can become infected. When this happens, the physician will use a scalpel to excise all of the adjacent tissue. The codes for excision of a pilonidal cyst are divided according to the complexity of the excision, whether it is simple, extensive, or complicated. A simple cyst would be excised and the wound sutured together. A cyst that's larger than 2 centimeters would require a more extensive excision and closure. A complicated excision is very extensive and usually requires reconstructive surgery. The introduction category contains codes for intralesional injections, tattooing, tissue expansion, contraceptive capsule insertion or removal, and hormone implantation. Lesions are injected for conditions such as acne, keloid scars, and psoriasis. They are selected according to the number of lesions injected. Tattooing may be used to disguise scars or birthmarks and is coded based on square centimeters covered. A tissue expander is an elastic material formed into a sac that is filled with fluid or air so it expands. The expander is placed under the skin and then filled with air or fluid to stretch the skin. They are often used to prepare a site for permanent implant. The codes are divided according to whether the service is insertion, removal, or removal with replacement. You might want to highlight the parenthetical instructions that refer you to 19357 if the tissue expander is used with breast reconstruction. Codes 11981 to 11983 are codes for the insertion and/or removal of drug delivery implants. The implants are used to deliver a therapeutic dose of a drug continuously at a predetermined rate of release. Various types of medications for various indications may be used. The next subheading is repair. When you are coding wound repairs, there are 3 factors that you'll need to know: the length of the wound in centimeters, the complexity of the repair, and the site of the wound repair. You might want to use your highlighter in these guidelines since there's a lot of detail to remember. The first paragraph in the guideline says that wound closure including sutures, staples, or tissue adhesive. However, if the wound closure uses only adhesive strips as the means of repair, you would report the appropriate E&M code. What this means is that if the wound is repaired using a butterfly bandage, a repair code would not be reported. You would report an evaluation and management code. Medicare allows the use of HCPCS Level 2 code G0168 for wound closure with tissue adhesive. You may want to make note of this in the guidelines for this section. When you look at the guidelines, there are 3 types of repair: simple, intermediate, and complex. A simple repair is for a superficial wound that involves primarily the epidermis or dermis that doesn't include the deeper structures. The closure is a simple, one-layer closure and includes local anesthesia. An intermediate repair includes the elements of a simple repair plus a layered closure of one or more of the deeper layers of the subcutaneous tissue and superficial fascia. However, if a single layer closure needs extensive cleaning and is heavily contaminated, it may constitute an intermediate repair. A complex repair is a complicated wound closure that includes debridement, extensive undermining, stents, and more than a layered closure. Here are the instructions for coding wound repairs. Number 1, the repaired wounds should be measured and recorded in centimeters. Number 2, the length of the wounds are added together by complexity and anatomical location. For example, if there is a 2.5 centimeter wound on the scalp and a 3.5 centimeter wound on the neck, and each require a simple repair, you would add the measurements of the 2 wounds together and report code 12002. Both of the wounds were of the same classification, simple repair, and anatomical classification. Neck and scalp are classified to the same code. However, you wouldn't add links of repairs from different classification and/or anatomical classifications. So if the 2.5 centimeter wound of the scalp required intermediate repair, and the 3.5 centimeter wound on the neck required simple repair, you would report 12031 for the intermediate repair of the scalp, and 12002 with a 59 modifier for the simple repair of the neck. 59 modifier says distinct procedural service. 59 is also saying that, hey, we did a repair, 2 separate repairs of 2 different locations on the body. There are 3 things that are considered components of wound repair: ligation, exploration, and debridement. Simple ligation of small vessels is considered part of the wound repair, as well as simple exploration of surrounding tissue, nerves, vessels, and tendons. Normal debridement is also included and not listed separately. If the wound is grossly contaminated and requires extensive debridement, a separate debridement procedure code may be coded, and these codes are 11042 through 11047. The next subheading is adjacent tissue transfer or rearrangement. Adjacent tissue transfer has the acronym of ATT. These codes include the excision of the lesion. Therefore, you would not code the excision of the lesion as well as the ATT. There are many types of grafting procedures that can be performed to correct a defect. adjacent tissue transfers or rearrangements, skin replacement surgery and skin substitutes, flaps, and grafts. The recipient site is the area receiving the graft, and the donor site is the area that the healthy skin is taken from. There are many types of ATTs. You have Z-plasty, W-plasty, V to Y-plasty, rotation flaps, rhomboid flaps, advancement flaps, and there are some others. You can see illustrations in your CPT code book of an advancement flap and a rotation flap. If you run into any of these mentioned plasties, rhomboid flaps, rotation flaps, advancement flaps, they are adjacent tissue transfers. We need to remember, we do not code the excision of the lesion as well. The subheading of skin replacement surgery and skin substitutes is in the code range 15002 to 15278. These codes report site preparation using a variety of grafting materials and repair methods using skin or skin substitutes. If the recipient site, which is the site of the defect is a problem, right? And these require surgical prep before the repairs, it is reported with 15002 to 15005. You would choose the code based on the location and the size of the resultant defect. Free skin grafts are pieces of skin that are completely freed from the donor site and placed over the recipient site. They are either split thickness or full thickness, and these are reported by the recipient site, the size of the defect, and the type of repair. The size in these codes are measured in square centimeters. The square centimeter measurement is applied to adults and children over 10 years of age. The percentage of the body area is used for infants and children under the age of 10. Let's go look at code 15273 in your CPT code book. It states application of skin substitute graft to trunk, arms, legs, total wound surface area greater than or equal to 100 square centimeters. First 100 square centimeter wound surface area, or 1% of body area of infants and children. A pinch graft is a small, split thickness repair and is reported with CPT code 15050. You might want to make a note next to 15050 because it is measured in centimeters, while all the other codes in this section are measured in square centimeters. How do we come up with getting square centimeters from centimeters? Well, you're going to take the length in centimeters times the width in centimeters, and that number will give you the centimeters squared. Autografts are taken from the patient's body, and allografts are taken from a human donor and can be dermal or epidermal. They are reported based on graft, depth, location, and size. Tissue-cultured epidermal autografts are coded 15150 through 15157 code range. These are grafts that are grown from the patient's own skin cells. A cellular dermal replacement is the use of skin replacement products based on the location and size of the repair. Temporary allografts are used to help protect defect sites while healing is taking place. Allograft and tissue-cultured allogenic skin substitutes are grafts from another person, and allogenic grafts are taken from a different person that are cultured. Xenografts are grafts taken from a different species. such as a pigskin graft. Skin substitute grafts are reported with 15271 to 15278 code range, and these are based on the location and size of the repair. The supply of the skin substitute graft is reported separately. There are two categories of codes for flaps. The first is flaps, skin, and/or deep tissues. These are coded with the range 15570 to 15738. They are subdivided based on the type of flap and then by the location of the flap. These procedures do not include extensive immobilizing device and/or closure of the donor site. These would be reported in addition to the flap closure. The second category is other flaps and grafts. This code range would be 15740 to 15777. The codes are subdivided based on the type of flap, free muscle, free skin, fascial, or hair transplants. The other procedures category contains a variety of repair services such as dermabrasion, chemical peel, and blepharoplasty. Dermabrasion is used to treat acne, wrinkles, or general keratoses. The skin is anesthetized with a chemical that freezes the area, and the area is sanded down using a motorized brush. Facial dermabrasion codes are divided according to the surface area treated. The abrasion technique is often used to remove areas of sun-damaged skin. Chemical peels are treatments in which a chemical is applied to the skin and then removed. This treatment is used for cosmetic purposes. The codes are divided according to if the peel is facial or non-facial, and the depth of the peel, epidermal or dermal. A cervicoplasty is the surgical removal of excess skin from the neck, usually for cosmetic reasons. A blepharoplasty is the removal of excess skin and from the upper eyelid. The rhytidectomy code range is reported is to report cosmetic procedures as well, and that is where we excise excess skin elsewhere on the body. Codes in the range 15830 to 15839 are for the excision of excessive skin from different parts of the body and includes a lipectomy. Grafts for facial nerve paralysis are used to report procedures where a physician harvests a graft from a location on the body and grafts the area damaged by facial paralysis. The code range 15876 to 15879 describes a suction-assisted lipectomy and is divided into body areas. If the procedure is done bilaterally, you would use the modifier 50 that states bilateral. Other codes in the category are procedures for suture removal and dressing change under anesthesia. You would not use these codes for routine suture removal or dressing changes not requiring anesthesia. As we discussed in the ICD-10-CM section, pressure ulcers are also known as decubitus ulcers or bed sores. They are found on the areas of the body with bony projections, such as the hips. Pressure on these areas cause decreased blood flow, and sores then form. Over time, with continued pressure, the sores can ulcerate, and the deep tissues, such as fascia, muscle, or even bone, may become affected. Pressure ulcers commonly occur in patients who are unable to change positions. The treatment for a pressure ulcer involves the excision of the ulcerated area to the depth of the unaffected tissue, fascia, or muscle. If the excision of the pressure ulcer includes with ostectomy, That means there is the removal of the bone that underlies the ulcer area. The bony prominences are chiseled or filed down to alleviate future pressure. The codes are divided based on location, type of ulcer, and extent of closure needed. Be sure to read descriptions carefully when coding from this category. In your CPT codebook, there is an illustration of the Lund-Browder diagram and the classification method table for burn estimations that you'll use when coding from the burns local treatment category. This method is used for estimating the extent, depth, and percentage of burns, allowing for the varying proportion of body surface based on age. Burn treatment involves dressing changes or debridement of burns, and based on whether the area is small, medium, or large. Code 16020 is the initial or subsequent dressing change or debridement of a small surface area defined as less than 5% of the total body surface area. 16025 is a medium area or 5 to 10% of total body surface area. 16030 is large or greater than 10% of total body surface area. This category also includes two codes for eschorotomy. An eschorotomy is a procedure where the physician cuts through the dead skin that covers the surface when there is a full thickness burn. The crust diminishes blood flow and healing. Code 16035 is the initial incision, and 16036 is for each additional incision. The destruction subheading contains codes for the ablation of benign, premalignant, and malignant tissue by any method, with or without curatement, including anesthesia, and not usually requiring closure. Destruction is the method other than excision. Methods may include electrosurgery, cryosurgery, and laser and chemical treatment. The codes for benign or premalignant lesions are based on the number of lesions. The destruction of malignant lesions is divided according to the location and the size of the lesion in centimeters. Mohs micrographic surgery is a surgery technique used for the removal of complex or ill-defined skin cancer. A single physician acts in two separate and distinct capacities, as a surgeon and as a pathologist. As described in the guidelines, the surgeon removes the tumor tissue and maps and divides the tumor specimens into pieces, and each piece is embedded into an individual tissue block for a histopathologic exam. If the lesion is malignant, it is immediately removed. However, this procedure usually involves stages where the surgeon removes a layer of skin and examines it for cancerous cells, then removes another layer of skin and again examines it for cancerous cells. This is repeated until there are no longer any cancerous cells identified. If a repair is performed, it may be reported separately. Now, let's turn to our CPT codebook to the Mohs micrographic surgery, and let's talk about those codes a little further. The Mohs micrographic surgery codes begin at 17311 to 17315. If you notice, 17311 covers the body areas of the head, neck, hands, feet, genitalia, or any location with surgery directly involving muscle, cartilage, bone, tendon, major nerves, or vessels. That code is for any of those areas for the first stage only, up to 5 tissue blocks. The 17312 is an add-on code that would need to be added in addition to 17311 if there's any additional stages beyond the first. For example, if we have 2 stages, the first stage has 4 blocks, the second stage has 4 blocks as well. How would we code that? We would code 17311 for the first stage, and that code also covers up to 5 blocks. So we only had 4, so we are good. The second stage is covered with the code 17312. There was 4 blocks there, and that code covers up to 5. So that is the only 2 codes we would need here. Now if we did a repair, we would need to go to the repair section and code that as well. However, in this example, we are not doing a repair. 17313 is for the trunk, arms, or legs, first stage only, up to 5 tissue blocks. The 17314 is an add-on code that would need to be added in addition to 17313 if you did more than one stage. Now, the 17315, if you have any blocks in any of the stages beyond 5, you would code the 17315 each additional block beyond the 5 of any of the stages. So let's talk about another example. So let's say we did a Mohs micrographic surgery on the legs. We had 2 stages, and we had 6 blocks in each of those stages. Well, we would need to find the code that contains the legs, and that is 17313. So the first stage, up to 5 blocks, is covered with the 17313. The second stage is covered with the 17314, up to 5 blocks. Well, we said we had 6 blocks in the first stage and 6 blocks in the second stage, correct? So how do we code those extra 2 blocks? We are going to code those with the 17315 times 2. So our answer for that situation would be 17313, 17314, 17315 times 2. You will have one of these type of questions on your national exam, so you definitely want to make sure you understand the use of these 5 codes. Remember, the 17311 and the 17313, those codes are for specific areas and first stage only, up to 5 tissue blocks. The 17312 and the 17314 are each additional stage after the first stage, up to 5 tissue blocks. Then if you have extra blocks, how do we code those? We use the 17315. And that is coded each block after the first 5 of any stage. Okay, moving on to procedures on the breast. The breast procedures are divided according to the category of the procedure: incision, excision, introduction, repair, and/or reconstruction. Breast biopsies are reported with codes 19081 to 19101 range. These are divided by percutaneous meaning through the skin, or incisional, with or without imaging guidance. Imaging guided breast biopsies include the placement of localization devices when performed. When an image-guided placement of localization devices are performed without a biopsy, code range 19281 to 19288 are reported. The introduction codes are for reporting procedures such as the preoperative placement of a needle localization wire to mark a lesion prior to surgical removal, or the placement of a radiotherapy catheter into the breast for interstitial radioelement application following a mastectomy. Mastectomy procedures are found in code range 19300 to 19307. You will need to read the operative report carefully to determine which, if any, muscles and lymph nodes were involved, since that will determine the code selection. Code 19305 is reported for a mastectomy radical, including pectoral muscles and axillary lymph nodes. Radical meaning more extensive. 19306 is a radical mastectomy, including pectoral muscles, axillary, and internal mammary lymph nodes. The repair and/or reconstruction codes not only are used for reporting reconstruction after a mastectomy, but there are also codes for a mastopexy, also known as a breast lift, or a reduction mammoplasty, also known as a breast reconstruction. Also known as a breast reduction. Now we jump over to the medicine section for the codes that are applicable to the integumentary section. The medicine section in our CPT code book is the last section in the book prior to the index. When we say medicine section, we're not talking about medications. We're talking about therapies, diagnostic testing. Some examples would be an EKG, a spirometry, allergy testing, and in the case of the integumentary system, this is where your photodynamic therapy is included, and this is going to describe the ablation of tumorous tissue by activation of photoactive drugs and other special dermatological procedures that are frequently rendered on a consultative basis. Actinic therapy involves exposing the patient's skin to ultraviolet light to treat skin disease such as acne. Photochemotherapy combines light, photo, and chemicals to deliver an effective treatment. Laser treatment for inflammatory skin disease such as psoriasis involves the use of a beam of laser light concentrated on active psoriatic skin plaques. Now we jump over to the HCPCS Level 2 code book, and we have a look at some codes that you might run into that relate to the integumentary system. First, you've got G0127, which is trimming of dystropic nails, any number. G0168 is wound closure utilizing tissue adhesive or adhesives only. 60295 is electromagnetic therapy to one or more areas for wound care other than described in G0329 or for other uses. G0329 is electromagnetic therapy to one or more areas for chronic stage 3 and stage 4 pressure ulcers, arterial ulcers, diabetic ulcers, and venous stasis ulcers, not demonstrating measurable signs of healing after 30 days of conventional care as part of a therapy plan of care. And this concludes our lecture for integumentary coding. If you have any questions, please reach out to me, and I look forward to seeing you guys here for Chapter 8, which will be the musculoskeletal system.